We are called to serve humanity, endowed with the art and science of caring. We are built on integrity and discipline that transcends through every generation. Immaculate and amicable, we are the source of hope to anyone, and the foundation for building a healthy.
Just like what you said, that malaria, like that it occurs in most especially in pregnant women and some under 5 age children, and that is why in antenatal clinics, that is why they do emphasize on treatment of malaria in pregnant women, because most one of the complications of malaria in pregnant women is jaundice. Because when they later give birth to the child, there will be jaundice as a result of malaria. So it is very, very important for pregnant women for them to be treated. Is either you prevent malaria or you should treat it during pregnancy to avoid complications like jaundice after delivery. And also in young children, also children with severe malaria, they frequently develop one of the following symptoms, such as severe anemia. When we're talking about anemia, for the sake of those of us that were not familiar with these things, anemia is reduced oxygen carrying capacity of the blood, and it can be evidenced by pale paleness. The conjunctiva will be pale, then the pallor, the palm. When you compare your palm with someone that is maybe someone that does not have anemia, you see that your horn is somehow whitish. That is anemia. And also your fingertips, it looks pale and all of that. So severe anemia occurs in children with severe malaria and also respiratory distress. So malaria is not as simple as we take it. And we have cases of children who have cerebral malaria that affects the brain. So it is not something that we can take lightly. It is something that we should prevent. It is something that we should take medications as soon as possible, as soon as we are sure that it is well diagnosed that we have malaria. Just as fact, in some cases we don't have. Some people might not have malaria, but they observe signs of malaria.
That comes to some things. When we talk about symptoms of malaria, we talk about fever, we talk about headache, we talk about body weakness, and most of these symptoms are generalized over a range of illnesses, not only malaria. And if you have, and most times over here in this part of the world, once you have headache and fever, people will tell you have malaria. You can take anti-malaria, and that might be wrong in some cases, because it is not necessarily when you have fever and headache that you have malaria. There are some other diseases and infections too that can present in the same way as malaria. So one thing is what we're advocating for now is once you feel any of these symptoms, confirm if it is malaria or not. And it has been made so easy that there are now test kits very fast. Within 2 to 3 minutes, you get your results.
Rapid diagnostic test.
Yeah, how it is. You know if you have malaria or not, rather than just giving yourself malaria treatment when you don't have malaria.
G for gentleness and love. Mercies are great, mercies are caring, and the epitome of humility in service. We are specially ordained for this occasion. Yes, I'm proud to be a nurse.
Also, another thing is the issue of malaria resistant, having malaria that's resistant to drug. Now, like I said earlier, most times when we don't have symptoms, or even when we have malaria, we take these drugs, and as soon as we feel better, we tend to stop taking these drugs. Imagine most of us have done it before. Imagine taking all these malaria drugs for 1 or 2 days, and I'll feel better. Let me stop taking it. Now, the vector out there, the falciparum, they are becoming resistant to these malaria drugs with time, because they are adapting to the drugs we used before. Before it used to be quinines for malaria, where we take chloroquine, camoquine to heal us, to treat malaria. But now we've gone past the stage of quinines. We've gone towards this ACT, artemisinin combination therapy. And even now, these drugs sometimes are not even enough to treat malaria because of what we do. Now, how do we cause this resistance? Once you take, it's like you are trying to kill something and you didn't kill it completely, just wounded that thing. Once that thing heals, it will become stronger.
Yes.
And whatever you used in killing that thing won't be able to
No.
kill it again. That's how these malaria stands work. Once you take the malaria and you didn't complete the dose, the malaria parasite gets weakened in your body, and once it's weakened, for a while you feel okay. Once it comes back twice stronger than before. That if you use the same drug, it won't work as it's supposed to work.
And that's why some people they will tell you that I do use
I've
artemether
used-
before,
yeah.
and then later on maybe they develop malaria again. They will tell you that this the particular drug that I used last week is not working again.
They'll tell you I've taken malaria drugs and it's not going, and they said I have malaria. So at this stage, I think we need to reach a conclusion where we have to take it in mind that whenever we are taking malaria doses, we have to complete it.
Even
Because
apart from malaria drugs, any drugs, you should follow the
because
prescription.
now all these diseases are evolving. They are becoming resistant to most of the drugs we take because of our non-compliance to our regular doses.
Want and the foundation for building a healthy world. Together we shall stand. No seas of grace, no seas of caring, an epitome of humility in service. We especially.
Okay, if you're just joining us, this is You and Your Health coming from Team Set FM by Sparkling Light Press Group, and we're discussing a very, very controversial and very, very interesting topic, which is malaria. And now to malaria, just as Sparks, you know, in the year 2010, there was an initiative known as Rollback Initiative. And the initiative was to reduce the outbreak of malaria. And again, now, you know, we've passed the era of 2010.
Yes.
And again, there's an initiative going on now that we need to reduce the rate of malaria by the year 2030. And how can this be done? They said there should be a means of reducing malaria by 90% in the year 2030. And also, we should reduce the mortality rate of malaria by 90% in the year 2030. And also, eliminating malaria in at least 35 countries in the year 2030. Then how can this be achieved? That will lead us to how we can prevent malaria.
Personally.
Okay.
Yeah, on the issue of prevention, we should, let me say, classify it in different categories. One, on individual parts.
Mhm.
There are, we do say it that even locally, when it's evening, you say don't open the door. Mosquitoes will come in.
Come here.
Now, during this period, let's try to avoid minimal contact with mosquitoes. How? When you are going out in the evening, let's ensure our trousers or our skirts are long enough to cover our feet, because it has been discovered that mosquitoes generally they feast mostly on the lower extremities. So when we wear long trousers and long skirts or socks in the evening, it tries to reduce our malaria bites on us. That's one. Then two, we have these mosquito repellent creams that people use all around, and we can use that. Although I don't really know how effective that is, you can also use it just to prevent mosquito bites.
Okay.
Then also use of mosquito nets when we are going to sleep. Ideally in places where mosquito is not endemic, there is no reason to use mosquito nets. But in places like here now in Africa, sub-Saharan Africa, where malaria is endemic, there is a need for use of mosquito nets, which our government have been trying so far to provide free mosquito nets for each household. Which you
And just as Sparks, about talking about the mosquito nets, many people they have mosquito nets that they have been using for 20 years. So they should be insecticide mosquito nets that is well treated.
Yeah.
And our government has been trying like getting mosquito net for people, but you see people collecting that mosquito net and using it to do like a farmyard to secure their farmyard.
fish nets.
So that is a bad idea. We were given insecticide mosquito net to protect us from malaria. So we should use it for what it has been asked to be used for. Some people they will complain that they can't sleep under mosquito nets that it is just less like prioritize the benefits. It will prevent you malaria, it will prevent you from falling sick. But you can improvise for if you have it, you can improvise by getting a fan or any other thing. So we should make good use of our insecticide mosquito net.
Then for those who say because of it, they can't sleep on a mosquito net. And one thing like I've always said on this program is our health is very important. Let's prioritize our health. And anything and malaria can go as far as causing minor symptoms that we feel normally to causing death.
Yes.
And it's not malaria is not something that is minor. It's something we need to tackle on a global scale. And malaria is one of the most potent diseases that kills under 5 infants.
Yes.
That's one of the that's how severe malaria can be. So let's try our best to prevent malaria on on our own individually. That's for individual parts. Now the second part I'm talking about is the environmental part. What are the things that makes mosquito endemic in our areas here? One, our drainage system. We don't have effective drainage system in our homes where there is what stagnation of water in our gutters in front of our houses. And one thing is malaria mosquito breeds in what stagnant water. They don't breed in flowing water. So this stagnation of water in our gutters in front of our houses can cause what breeding of malaria in our environment. Then two, in our homes, you see people pouring water inside a used pot for 5, 6, 7 days. All these things attract mosquitoes. Then three, bushy areas where there is bush, they call it where there is bush, there is what more mosquitoes in short environment. So our environment, we need to clear the bush, and secondly, prevent stagnation of water in our environment. Then we can go as far as using all these all these new set of windows they are doing now with nets on the other part, apart from using mosquito net to prevent what malaria in our homes.
We are called to serve humanity, endowed with the art and science of caring. We are built on integrity and discipline that transcends through every generation. Immaculate and amicable, we are the sort of hope to ailing ones, and the foundation for building a healthy world. Together we shall stand. No seas of grace, no seas of caring, an epitome of humility in service. We are specially ordained for this vocation. Yes, I'm proud to be in us. From near and far, we have gathered with one goal.
If you're just joining us, you're on to Team Said 94.1 FM, and the program You and Your Heart brought to you by Sparking Light Press Group. And if you want to read the studio lines, 070-3745-0890 or 090-3757-8911. Again, 070-3745-0890 or 090-3757-8911.
For gentleness and love, no seas of grace, no seas of caring, an epitome of humility in service. We are specially ordained for this vocation.
Now, moving on to the complications of malaria. The complications of malaria can move from being a mild complication to a moderate one down to a severe complication. So looking at the mild complication, it can just be from anemia, because one thing about malaria is that it leads to rapid breakdown of red blood cells, causing hemolysis. And when that occurs, it's number one, it can lead to jaundice. Then it can lead to poor blood supply to our vital organs like the heart, the livers, and the lungs. So that's a very severe, one of the severe complications. And also for children, just like we established in the first place, that it can cause cerebral malaria, and that is when malaria affects the brain. In most cases, children suffer from this most. So that's one of the complications. And apart from that, apart from anemia, apart from jaundice, apart from cerebral malaria, it can go down even to death. It has been recorded that a lot of people died from malaria. So it is not something that we should take with levity. It is something that needs to be treated. It is something, and before just like we established that before it is being treated, there needs to be adequate diagnosis. You should not, just because you are exhibiting some signs and symptoms does not mean that you have malaria. There is a microscopy test in which they ask you to go and do blood test, in which you are confirmed if you have malaria, or a rapid diagnostic test in which it is well confirmed that you have malaria.
An initiative and vulnerability. G for gentleness and love. No C's are great, no C's are caring, an epitome of humility in service. We are specially ordained for this vocation. Yes, I'm proud to be a nurse.
By just joining us, you're on to Team Said 94.1 FM, and it's a program You and Your Health brought to you by Sparking Lights Press Group. And if you want to reach us and you have any questions for us, you can reach us through the studio lines 070-3745-0890 or 090-3757-8911. Again, 070-3745-0890 or 090-3757-8911.
Immaculate and amicable, we are the song of hope to erring ones, and the foundation for building a healthy world. Together we shall stand. No C's are praise, no C's are caring, an epitome of humility in service. We are specially ordained for this vocation. Yes, I'm proud to be a nurse. From near and far we have gathered with one goal, to uphold the good name of our profession, and for neatness and splendor. U for understanding, R for responsiveness, S for selfless service, I innovative and initiative, N for vulnerability, G for gentleness and love. No C's are great, no C's are caring, an epitome of humility in service. We are specially ordained for this vocation. Yes, I'm proud to be a nurse.